that are who came to consent. So each patient has the right to opt out of any social media coverage. So that means lives, photos being taken, you name it. So no, we don't, for sure. But we try to go live, especially on platforms like Instagram, TikTok, just to give our audience a way to see what's happening in the OR. However, even still, like it's okay. Like it's a very personal thing to have your surgery recorded or have somebody talking during your surgery. So we do not. If you're worried about that for yourself, we do not. I'll just ask you some questions before your surgery to see if that's something you're comfortable with. But again, if you're not, we don't. Just to kind of clear up the air. A lot of patients do consent, and so that's why we go live as frequently as we do. Whenever Dr. Geneby's patients consent to YouTube or whatnot, we try to go live there, especially just because we're allowed to show the surgery there. And why that's so important and vital to us is a lot of our potential patients, our future patients, even patients themselves will go back and rewatch those lives or join our lives to get an idea as to what's happening here in the OR. So that is, yeah, Vero, of course. And again, if you'd like to share what kind of procedures are you having done with Dr. Jeneby, would love to know, would love to hear, and I'd love to hear your experience and your feedback. Again, this lovely patient that Dr. J is currently in the OR with, she's just having lipo 360 done and Renuvion. She is a very young patient, very fit already, but she just wants to have a more snatched appearance. So that is kind of what has led her to seeking help and finding Dr. J. Again, she's just coming in to have lipo 360 done and Renuvion done. So as you can hear in the background, Dr. J is joined here with Dr. Phillips, and they are just doing some liposuction right now. So again, that is just suctioning the fat. Right now, Dr. J and Dr. Phillips are suctioning the fat on her back, on her sides. And then from there, they will go in and use Renuvion. Essentially, Renuvion is a skin tightening tool that they, Dr. Jeneby and Dr. Phillips like to use to tighten the skin after liposuction. It works by heating up the skin from the inside out, essentially, and causes the skin to contract. And so on the outside, it just leaves the skin to appear very tight. It's highly recommended for those who are over a certain age. Generally, for any liposuction patient, it is recommended. Of course, it's not necessary, but it is highly recommended. Again, hope y'all are having an amazing day this morning. We'll get as much coverage here as we can. With this patient, like I mentioned, it's going to be pretty quick with the liposuction and Renuvion. It's not going to take long at all. We'll take a break, and this patient will be flipped over after lipo is done on the back. We'll flip, and then we'll come back, and then Dr. J has a second case later today. His second patient is having a lot more done. She's having a tummy tuck done, a augmentation, so definitely stay tuned for that. Hopefully we'll be able to give coverage for that patient as well.
My daughter's MRI for her leg, so it came back normal. Oh, here we go.
And if you or someone you know are interested getting in contact with our team. We would love to answer any questions that you have. You can start by filling out this form, or you can put in a patient's information in that form, and from there we can reach back out to you, providing you information with a quote. We can provide you information with what pre-op and post-op is going to look like, what it takes to get into the OR, whether or not you're healthy enough for the surgeries that you're interested in, and whether or not we can make exceptions to your case. So we can also provide you with more financing information. Again, we'd love to get in contact with you. You can start by filling out this form here on the box. And as you can see there on YouTube, Dr. Phillips is now getting started on some Renuvion for this lovely patient. So they just finished doing lipo on her upper back. And so where the liposuction was done, it heats up the skin to contract, and then from the outside, the skin just appears a lot tighter, essentially.
Was Danielle. Remember Danielle? What's that? Remember Danielle, our maid? Yeah, she looked like Danielle. She did? Yeah, that's a good doctor.
And so as you can hear there in the background, Dr. Jeneby is still doing liposuction with the patient's backside. Dr. Phillips is doing Renuvion. We will wrap it up here shortly and go ahead and flip the patient and then resume with some more lipo on the patient's stomach, following with Renuvion after. Y'all should be tuned. And then Dr. Jeneby has a second case after this lovely patient. His second case is going to be a tummy tuck, along with some other procedures. I believe there's a breast augmentation, so there's a lot more happening there. But we're also showing this patient's procedure on YouTube. Feel free to join us. You can find it at Dr. Jeneby Plastic Surgery, or you can find it there in that link that is in the bio. Again, for those of you Dr. Jeneby is currently in surgery right now. This lovely patient came seeking help for some fat removal. So this patient is having lipo 360 today, followed with Renuvion. This lovely patient is younger and she is more fit, but she was just kind of seeking help with becoming more snatched in the waist. And so Dr. J, that's kind of what led her to Dr. J. Again, this lovely patient, she's having lipo 360 with Renuvion. And for those of y'all who don't know, Renuvion just helps to tighten the skin in the areas where liposuction was done.
is the, you're looking at everybody.
So everyone, I thought the last one was 150.
Alright, guys, we're gonna wrap it up. Thank y'all for joining us, and we'll be back after this break.